Good afternoon, everyone. It's Dr. Daniel Bodkin from Proactive Athletic Performance. And in this video, I'm going to break down an isometric test report for the quadriceps and hamstrings after an ACL reconstruction. For ACLs, we can use the isometric strength test as early as 2 months post-op. But for most patients, waiting until the 3-month mark is usually most appropriate. And this test is safe to perform in the early phases of an ACL plan of care, and it's effective in establishing baseline strength and identifying those who are going to have difficulty regaining their strength in the middle and late phases of rehab. And given that we perform this test around the same time that our ACL athletes are typically returning to running, this test can let us know if the athlete has regained enough strength to begin running without causing irritation to the joint. In another video, I'm going to break down an isometric test for the quadriceps rate of torque development, or how fast the quad is able to fire, but that test is performed later in rehab. So here's our test report, and at the top we have the athlete's information. And if we look at his date of surgery and the date that the test was performed, this is the 2-month test. And this athlete had the ACL reconstructed with a patellar tendon graft, the MCL was also repaired, and both the medial and lateral meniscus were repaired. So this athlete had a lot of trauma to the knee with the initial injury as well as the surgery. If we drop down below, we have data first for the quadriceps. If we look at the graph, we see time running across the x-axis for 5 seconds. On the y-axis, we have the torque. So the harder the athlete is able to push or pull into the dynamometer, the higher the line will go. The red line is the left limb and the blue line is the right. And we can see a big difference in strength of the right leg because it's the surgical side. And this is what we should see this early on. So visually, we can see the deficit in the quads. Let's move over to the left side for the strength numbers. And what we're really paying attention to is the top row, which is the peak torque achieved. Or in other words, the maximum amount that the patient was able to push or pull into the pad. Here, the left leg, which is the non-surgical side, was able to achieve 114 foot-pounds, and the right injured side hit only 47 foot-pounds, and that gives us a 59% deficit. Now, at the end of rehab, when the athlete's ready for return to sports, we want to see this side-to-side strength deficit to be less than 10%. Anything over 10% is going to put them at a higher risk of re-injury. The last thing to look at for the quadriceps, and it's possibly the most important overall number on this report, it's in the far right column, and that's the torque relative to the patient's body weight. When the patient goes back to their sport activity, this should be 100%, meaning that the quad is able to achieve 1 foot-pound of torque for every 1 pound of body mass. Anything less than that is going to put that athlete at risk of re-injury when they go back to their sport. Our athlete's surgical side is only at 28% of his body weight, so he's essentially 1/3 of the way for his overall goal. And this is actually pretty good for being 2 months out with all the different structures that needed to be repaired. If we look at the uninvolved healthy side, we see that he's hitting 69% of his body weight. And remember, this needs to be at 100% when he goes back to his sport. But what happens after injury, and even more so after the surgery, is that the healthy leg is going to lose usually between 20 to 30% of its strength. So this leg is down about 30% from where it needs to be when he goes back to sports. Now, for safe return to running, research shows us that the quad should be able to hit 50% of the body weight in order to reduce stress to the joint. Now, our athlete's only 2 months out of surgery, and we don't even start talking about returning to running until about week 12. So the fact that he's only at 28% of his body weight at this point isn't anything we need to be worried about. But we want to see this number get up to 50% of his body weight before we allow him to start running. Now, physically, he'll be able to begin running before that, but he might have alterations of his running mechanics. But more importantly, if he's not able to hit 50% of his body weight with that surgical side quad, he's going to get irritation to the knee if he tries to run. Now, we're going to retest this athlete in a month, and we're going to see how much strength he picks up in that time and how close he is to hitting that metric at that time. Next, let's drop down to the hamstrings. And looking at the graph, we can see the deficit of the left leg's red line, but it's not as big as what we saw up at the top for the quads. Looking at the numbers, we see the healthy side achieve 54 foot-pounds and the surgical side hit 19. So that gives us a side-to-side deficit of 65%. And remember, we only want a side-to-side difference of 10% when he goes back to playing his sport. But if we move to the far right column for the torque relative to the body weight, the healthy side hit 33% of the body weight and the surgical side is at 12%. And for healthy individuals and after an ACL reconstruction at the time of return to sports, this number should be 60% of the body weight or more. So that puts the healthy side at about half of what it needs to be at his return to sport point, and the surgical side is only about 20% of the way there. So we expect to see a gross weakness of the surgical side and a slight weakness of the healthy side. But this test report shows us that he also has a significant weakness of the healthy hamstring. So that's something that we need to pay attention to even more in the next few phases. Lastly, let's look at how the hamstrings compares to the quadriceps. And we have an ideal muscle balance between those two muscles to protect the ACL against loads that are going to be placed upon it. So if we take the number achieved by the hamstrings and we divide it by the number achieved by the quadriceps, that gives us the hamstrings to quadriceps ratio. And the ideal ratio is between 0.6 to 0.8 or 60 to 80%. For the surgical side, our athlete is only at 0.4 or 40%, and for the healthy side, he's only at 0.47 or 47%. So even though both muscles need to get stronger, we want to make sure we get this ideal balance restored as he continues to make strength gains. So for this athlete, we're going to continue with our plan of care. We're going to continue working on increasing the strength of all the muscles on the involved side. But we're going to also make sure that we're dedicating a little bit more time to the hamstrings for both sides. We're going to retest this athlete in 1 month when he's at the 3-month mark to check his progress. And that's going to allow us to make sure that our interventions are effective. At that time, we'll also be able to check how close the athlete is for beginning his running program, because we do have recommended strength output numbers of the quadriceps before the athlete starts running in order to not irritate the joint and slow him down in that next phase. That's everything for the isometric test report breakdown. Thank you very much.